All right. Time being 6:01, I'd like to call the Board of Health meeting to order. Um, we are missing Linda Dickey and Christina Pfeiffer. Present is myself, Alex Hegarty, Aaron Christian, and our health director, Marty Golightly. So first agenda item is COVID-19 update. So Marty, if you'd let us know where we are for numbers.
Yeah, I'm sorry. I'm having issues with the website on my end, not the town's end. It's 87 active cases with 1,515 total, and 97 currently in quarantine, which again, I mean, that's trending in the right direction. So whatever we're doing, please keep up the good work. Keep looking for your vaccine, keep wearing your mask, keep washing your hands. And you know, the lower those numbers go and the higher the number of vaccines go, we hopefully we can loosen some more of the restrictions. I mean, other than that, there's not a lot of huge amount of changes in since our last meeting, which, except for the fact that last month at this time, we were up over 160. And January was one of the worst months of the pandemic, if not the worst month of the pandemic since it started. So this is a better start to February, and let's keep that momentum rolling.
Absolutely. Any concerns or information about the new strains popping up, or is that just gonna as it develops?
A little, yes to some of that. So I am concerned about the new strains, and I know that Moderna and some of the other companies are looking at adding that to their vaccination boosters for those particular strains. The good news is it does appear to have some efficacy, and I highly encourage everybody to go watch the video that our PhD friend Dr. Tom did on Friday, so everybody can kind of get a handle on that better than I could describe it right now. And we know that to prevent those new strains, it's the same way as we prevent the current strains by, you know, wearing your mask and making sure that you're washing your hands. So that's one of those things that as the science comes in on that, we'll just have to keep an eye on it. I know that we've had some of the UK variant in Massachusetts. I would be shocked to find out that there are none of the Brazil or the Denmark or the South African variants that haven't already been here. But if they're more virulent, virulent, then they will outcompete the current one. So we just need to make sure that we are vigilant in our countermeasures and make sure that we're doing everything that we supposedly can. And that will help all of them. And then getting large amounts of the population vaccinated again will also help.
Awesome. Aaron, Alex, you guys have any questions on COVID-19 update before we move on?
Not that I'm aware.
No, Marty did a great job.
All right. So next agenda item is also you, Mr. Golightly, update on our vaccines.
My favorite update. So far, Abington has vaccinated 214 people. We were supposed to do another 150 at the senior center today, but because of the inclement weather, we decided to postpone it until Wednesday. So I will tell everybody who had an appointment today, you have that exact same appointment on Wednesday. So just come at the same time you were scheduled to come today on Wednesday, and you'll get, nothing will change. And I'm hopeful to have another clinic next week. I don't know exact details yet, but it looks like it's going to happen, and we will either free up 100 or to 150 doses, depending upon our allocation. Everybody knows how I feel about this. This should be no surprise that I am very pro-vaccine, and I am very pro-Abington being able to perform quite a bit of the vaccine. I'm estimating our capabilities, this is a very rough estimate, does not include weekends, to be about 1,500 to 1,700 a week. Again, that's only running 2 clinics a week. And if we bump that number up, we, extrapolate that further. But our limiting factor is the state's movement into priority, or priorities 2 and 3 in phase 2, and our delivery of vaccines. I am as eager as everyone to include 65 and over with 2 comorbidities, or people with 2 comorbidities, teachers, DPW, transit workers, all of those people. I am as eager as everybody else to get those people vaccinated. But our limiters right now are the state moving through priorities and getting our hands on some doses. I made a large order today. Whether or not it is approved, we will find out. It is not for lack of asking. I want the state to say we only have this many, and I don't want to be left out without getting any by not asking for as many as we can handle. And we have the infrastructure to handle quite a bit.
Yeah, I know you guys have been working very hard on this since March of last year. It's been a year almost. Well,
so we are ready. Our plans are approved from the state. Our people in Abington are highly qualified and knowledgeable. We have a great MRC that is local to us that we have been able to cultivate just with our friends, our citizens, our residents of Abington. Our MRC is awesome. Our crews are awesome. Our fire department and police have been really great. I can't say enough nice things about the school committee. There has been cooperation across all departments, which is refreshing at the very least and awesome, if I'm being honest.
All right, and just to reemphasize for anybody that happens to be tuning in, if you had an appointment for today's clinic, your appointment is the same on Wednesday. And if they have any conflicts, they should call the health department.
We will work it out. And I've heard a lot about the extra doses. If we get any, we'll work our way down the list of people who are eligible. Also, do not come if you do not have an appointment. I don't want people out in the parking lot waiting, hoping to get the vaccine. I promise you, as soon as we get more, we will let you know when it's safe to come in for you to get it. So please, I'm asking as politely as possible, do not come to the senior center unless you have an appointment or unless we have called you to come in to be able to make one. Please do not come thinking that there is some magical, extra doses. We just simply do not have it. But as soon as we get more doses, we will go down the order that people called, either the senior center or our office at equal parts, to get as many people in there as fast as we can. And I may not be able to give you much notice. It may be, we're going to have a clinic on Wednesday. Would you like to come on Wednesday? And that might be about as much notice as I can give you, because the state does not want us to sit on any vaccines, and I certainly don't want to sit on any vaccines. So it will be catch as catch can.
Excellent. And some people have been asking, people who are going to be in the next step have been asking about that. So the first announcement is going to come from the state, correct? When we move into the next step.
Right. So when we move into priority 2, it's the governor, or sometimes we find out about 5 or 10 minutes before he makes his announcements via the press conferences. But I anticipate he will announce that we're moving into it. Should we find out before a general announcement, we will put out one of those constant contacts that the board and members love to share from their Facebooks. Thank you for doing so. That says what exactly the next step is. We might not be able to accommodate a working list like we are for the 75s and over, because the next priority is going to be a vastly larger group of people. So it may be we just set up a clinic and allow for signups to it. So again, we're working through this as best we can. Do I wish there were changes, and do I think we could have done it better? Yes. But we have to work in the system that we have. So we will do so, and we will do so as effectively as possible.
And for those that are concerned, I want to remind them that we are not the only resource for vaccines, correct? They can get them. I recognize that there's been some difficulty in getting through to the state-run ones, but they are available, as well as doctors' offices and
other places. Please, and the more places giving the vaccine, decompressing one healthcare delivery system is better for us all. And the more people that get the vaccine will lower the number of people in the ICU, which again is better for us all. So I encourage everyone to get on the state's website and see if they can navigate that. There's also the call center that people can call. We recognized early that it was going to be difficult for our 75 and olders to actually get onto the PrEP mod registration and make their own appointments. So that's why we instituted something like calling the senior center or calling our office, because there could be some type of technical logistics issue for some of our seniors, and we didn't want to exacerbate an already stressful situation by asking them to do something that that they just might not be comfortable doing. Whereas we have the infrastructure to have our seniors call, or have the COA staff call. And thank you to Suzanne DeJessberg and Amanda and Amy and Angela over at the Senior Center. They've really been helping us out. So everybody that had an appointment today should have gotten a phone call. And in the future, when we have more, they will get another phone call saying, we would like to schedule you an appointment. Please come on X day. It'll be a very happy day for us all. I hope that answered those questions. I think I didn't leave anything out. But again, I want to reiterate, do not come unless you have an appointment. Please. Please. We will get to you, or the state will get, somebody will get to you, but please do not come if you don't have an appointment.
We want to say something that on behalf of many residents in town and people who have reached out to Chris and I, Marty, and to Lindsay, thank you so much for everything you're doing with the vaccine distribution. I know a lot of people really appreciate what's going on, and thank you for everything you guys are doing.
You're very welcome. It is, it's what we do. It's what we enjoy doing to a certain extent. It's important work. And I do want to add, Chris, I'm sorry if you'll indulge me for 1 second about the vaccine. One more update. If you are an elderly citizen who is primarily housebound, we will come to you as soon as we can. And when I say housebound, it's like you have difficulty with mobility, or you have a caretaker and you're not allowed, you can't leave the house for whatever reason. Call the office, and we will make arrangements to come to your residence and give you the vaccine there. We can't do that for everybody, but if there are certain situations where a person cannot leave their house for whatever reason, give us a call and we will find out whether or not you are a good candidate for us paying you a visit to get you the vaccine.
Excellent. And if anybody's interested in helping out or volunteering, should they give you a call? And
yes, right now we were lucky. We started establishing a rather robust MRC. MRC stands for a Medical Reserve Corps, starting as early as, I don't even know now. It feels like years, but it's been a while. And we have a good group of volunteers, which includes many of the school administrators and a lot of just people who are just wanted to volunteer out of the kindness of their heart. Call us at the Senior Center. Call us at the health department, and we'll reach out if you're really interested in volunteering and you have a skill set and you have the patience to help us out. In my opinion, the more members of the MRC, the better we are. Is it a functioning state-recognized MRC? The answer to that would be no, but the additional answer would be not yet. That's next, but I'd rather get a lot of vaccinations done before we work on being an actual recognized MRC. But our local people have been fabulous. So if you want to volunteer, 781-982-2119. My email's on the website, Chris's email's on the website, Alex's email's on the website, Lindsay's email's on the website. Shoot us a note. We'd love to have you.
awesome. All right. We haven't had any questions, Aaron. Nobody.
Not on Facebook, but I just have something I want to just make sure I clarify with Marty here. So you said earlier that our capability is doing what, 1,700 a week, but we don't have that many doses, right?
Conservatively 1,700.
So I just wanted to make sure that we say that we, just because we can do that, we don't have that many. So don't come asking us for those doses. Those don't exist.
If I had that many, there'd be 1,700 patients on the list already. I promise you. Me and Lindsay would be breakdancing into the office with joy that we were getting to give that many vaccines out.
Yeah. As I mentioned when our recording on Friday, I can speak from experience. There's no one in this town that wants to stick you with a needle more than Marty and Lindsay. So rest assured, if they could, they would.
So we've looked into some different means of allocation. We've asked for the Pfizer vaccine. It's a bit more complicated to store, but we have partners at the Brockton Hospital Pharmacy who are kind and generous souls who are willing to work with us, and so we will utilize them if they're kind enough to work with us. Yes, we will, absolutely. So that might increase our dose allocation. I honestly don't know yet, but I am hopeful that it may. So please stand by, and we will put clinics out via the constant contact first. And if while we're doing 75 and older, we would ask that we contact them to schedule it, or some may be able to. But so please be patient with us. We are as eager as you are. As Chris said, nobody wants to stab you more than me and Lindsay.
Awesome.
Vaccine.
Any other questions for Marty, guys? All right, that's our light agenda this evening. So if anybody wants to make a motion to adjourn,
I will make a motion to adjourn. See, Alex, I beat you to it.
Oh, thanks. I'll second that motion.
All right, all in favor? Aye.
Aye.
I will see you at the senior center on Wednesday. Thank you very much.
All righty.
Absolutely.